More flexible. Joining us now is Dr. Luiza Petre, assistant professor at Mount Sinai School of Medicine. Great to have you on. What are you expecting this study to show? Do you think that it's going to be effective to mix these vaccines?
Jill, definitely from a scientific perspective, it's interesting if you combine two vaccines who have different mechanism of action. The idea is that we might have stronger response, and this has been seen priorly with Ebola vaccines. And actually, it happens I myself in that path as I received part of the trial Oxford vaccine, and later I have received the Pfizer one, and I have tolerated it very well. But the principle here is like if you attack immunity from two different angles, the speculation is actually we could have better response. And it also will become cheaper. As we know, the viral vaccines like Oxford and Johnson & Johnson are cheaper. They are more versatile. They're easier to transport. So it will allow people more flexibility when it comes to supply chain with the vaccines.
If it is, as you expect, proven to be successful, do you expect that we'll start doing that here in the United States, or do you think that this is just something that'll happen overseas?
The United States, it's one of the last to adopt this kind of innovative changes just because we have a very strict system here. We have a very rigid regulation system for safety. So I think United States is going to be a little bit more cautious on adopting any new trends before they make it clearly it's effective and safe.
The CEO of Johnson & Johnson yesterday saying, I think what a lot of us had thought, that you might need some type of booster shot every year or a COVID vaccine every year, similar to the flu shot. Do you think that that's probably the case and what we should be expecting?
That's absolutely the case, Jill. This virus will be living with us for many years. It will become from pandemic and endemic like the flu, and will require booster for two reasons. One, because we'll see more new mutations, and second, because immunity doesn't last and we need to ramp up and reawaken the immunity. So definitely we'll have for the next few years.
How long do you think immunity does last if you get the vaccine?
We don't really know, but it's estimated at least 9 to 12 months. Now the challenge comes because of mutations, and it shows that with the new mutations, prior immunity not be as good as covering.
How concerned are you about the South African variant? I know in South Africa they've said they're going to not. They're holding off on doing the AstraZeneca vaccine. They are going to start with Johnson & Johnson. How worried are you about these mutations and what they might mean for the vaccine efficacy here in the U.S.?
The new mutations are definitely going to affect the trajectory of recovery from this pandemic. It would complicate things. And also, it's kind of a red flag, the South African mutation, that we might develop our own mutation here in the United States. So this really only shows how important it is to tackle this virus quickly, because more it has time on the playground to mutate, more we will see these resistant strains. And when it comes to vaccines, it will kind of become a moving target. We'll have to update the software each time we have a new mutation coming around. So it will definitely make the progress more challenging.
It looks like there's more confidence in the vaccines right now. About half of Americans say they want it. But we are still a long way to go. Dr. Fauci has said you need 75 to 80% of Americans to be vaccinated for any sense of normalcy to happen. Is that kind of the threshold that you're working with also, that you really need 75 to 80%? Or if we're at a lower point because so many people have had the virus, maybe we can eventually go outside without our masks on?
There are two goals here. Yes, indeed, for herd immunity, we need around 75% of people to be vaccinated. This way, the virus will stop spreading. We'll have no room to go from one person to another. But when it comes to vaccination, I think it's vital that we cover the most vulnerable people, because those are the ones that have the highest death rates. So, handling this vaccination process from two angles. One, vulnerable people. Second, having enough people in the general population vaccinated. And as you said, there's a positive movement there when it comes to confidence surging in the United States. And it's just because we see more and more people vaccinated. We have more data that actually there are no major side effects any different from the trials. And I think people are kind of seeing friends and families, and they're just becoming more comfortable. And everyone is tired of this COVID. Vaccine is probably the fastest way out of it.
Do you think that, the messaging around the vaccines has been, once you get the vaccine, act as if you almost haven't had the vaccine. You still have to do everything exactly the same way, wear masks, avoid crowds, no hugging your family members. Is that maybe the wrong message? Can you let your guard down a little bit if you've been vaccinated?
Absolutely not, Jill. We cannot become complacent here. Because first of all, we don't know if, even if you are vaccinated, you can have the virus and be asymptomatic. We don't know that, and you still can spread it to other people and put other people at risk. Also, if you develop a virus and you don't have 100% protection, that could actually provide some grounds for mutations. And we don't know if this further variants they're developing in the future will be escaping this vaccine. So definitely that's not the time to lower the guard at this time. Don't let the calm in the storm distract us.
All right. Great insight. Luiza Petre, assistant professor at Mount Sinai School of Medicine. Thank you so much for coming on.